Are you experiencing low back pain, hip pain, knee pain throughout your day? Well, this may be coming from weakness in your core. I'm Dr. Jana Ott from Tolt Travel Therapy. I have my partner Thor here with me today, and we're going to be talking about the deep core muscles. So, what is the core? Now, when I think about the core, I actually think of two groups of muscles. First, we think about the transverse abdominis. This is a muscle that comes across the front of the hip and it goes all the way around and connects into our spine. When this muscle activates, it's oriented this way. It pulls everything in. It's almost like our body's own natural back brace. This supports our spine and our pelvis and gives us a strong base to move off of. I also include in the core our glute muscles. We've got some other videos you can check out more specifically related to the glutes, but today we'll be talking about the transverse abdominis. Now I think about our core as the surface that we're moving off of. So for example, if you were standing on a solid floor and you reach, it's not that challenging. But let's say you're standing in a boat on a lake and you try to reach, and it's going to be really wobbly because that boat or canoe isn't sitting on a solid surface. So your core is either a sturdy floor or a tippy canoe for the rest of your body. If you've got strong core muscles, everything you do with your arms and legs is going to be easier. So the core muscles help with supporting the back, as we've talked about, stabilizing our body as we move throughout the world, and creates this solid surface for us to work off of. What that might look like for you is reduced back pain, improved posture, enhanced athletic performance, injury prevention, and even pre- and post-pregnancy support and recovery. These are all areas that can be helped with the core. So why are these weak in people? A lot of times, pregnancy, obesity, having pressure on those muscles in the front of our body causes them to lengthen, stretch, and become weak. Our posture throughout our day also affects our core. When we're very passive in our posture, not using very many muscles to support us, then those muscles just get weaker and weaker from not being used. So remember that even in sitting, our posture throughout the day should be active. And these are the muscles we're talking about recruiting so that you're not just sitting in passive positions and putting more stress onto your spine and your joints. Other things that can affect our core strength is living a sedentary lifestyle, not moving as much, sitting. A lot of people have desk jobs where you're sitting most of the day, and general energy conservation, I call it. But this is kind of our body's idea where we're trying to be the most efficient, not use very much energy, and in turn, that means we don't turn on our muscles very much throughout the day. So Thor, as we've worked together, we've definitely incorporated some core training to help you recover from injury. Can you tell me a little bit about your journey on learning about these core muscles and how they've affected your daily life?
Yeah, so especially in recovering from my hamstring injury, obviously my hamstring is not my core, but I learned that my mechanics in sports and just daily living was much easier on my body when I actually activated my core properly. I think especially during running, I didn't use my core as much as I should have, and I was really an inefficient, sloppy runner because of it.
Yeah, so kind of like that tippy boat on the water, it was harder to move your legs, harder to use your hip because you didn't have a stable base to move from. Yeah, definitely. So Let's just try activating this core muscle together as a way that you can do a self-assessment to see if you're using this muscle throughout your day. So to start, find the hip bones that stick out in the front and bring your fingers just inside and a little down from there. So right now it should feel soft. What you're going to do to activate this muscle is imagine drawing your belly button towards your spine. Or some other ways to think about it is like you're pulling these two hip bones to touch in the center, putting on a tight pair of pants and you're trying to get it buttoned. You kind of pull your belly button back. Or a third way to think about it is even pulling up and in with your pelvic floor. So trying to stop the flow of urine or holding gas also helps to activate that transverse abdominis muscle. Can you feel it with your fingers when you're activating that muscle?
Definitely.
Perfect. So that's a great way to start, just practicing feeling your muscle turning on. In sitting or lying on your back, that's a really supported way to practice this. But of course, it's going to be more challenging when you're unsupported sitting, when you're standing and trying to turn that muscle on. All of these pieces give it more of a challenge. So my goal for you is to try and use this muscle all throughout the day. And also we want to remember that this is an endurance muscle. So it actually works best at about 50% of its full ability to contract, which means you're not doing a sit-up or a crunch all throughout the day. That would be hard to breathe and walk and move. It's a gentle activation which helps support you as you're doing your other movements. It shouldn't hinder you. So now that we've got the basics here, you can incorporate this into everything. So I just want to tell you a few other examples of some clients who have really benefited from this type of work. So I have had a woman who was 6 months post-pregnancy, trying to care for her little baby, but she also had a diastasis recti, which is separation of some of her abdominal muscles. It's not uncommon with pregnancy. So by building up this core strength in the transverse abdominis muscle, it helped to bring those abdominal muscles close together for healing and give her support to lift and carry and breastfeed her baby throughout the day without additional strain on her back. Similarly, I've had an athlete who is an avid mountain biker and was getting low back pain anytime he biked more than 20 minutes. And again, small amount of training of activating his core, activating it in those specific positions that he needed to use for mountain biking, and he was back to the mountain in no time without back pain.
A lesson that I learned is that where you're feeling pain is a symptom, but it's not necessarily a symptom of weakness at that site. So if you're feeling low back pain, well, it's a problem you're feeling low back pain, but it's not necessarily true that it's your lower back that needs strengthening. Maybe it's you're not using your core properly, you're not engaging it and stabilizing, and the result of that is that your back is having to do work it wasn't designed to do.
Yeah. In physical therapy, we often say the thing that's hurting, it's not its fault. It's coming from somewhere else often. So great example of that. And remembering that this core strength training is really the base to help with everything else you do. It's not necessarily something you do just for one activity or just for one instance in your day. You want to be using this all the time. Thanks for joining us for our talk about the core. Come back for our next video where we'll get into the exercises that help to strengthen it. See you in the next video.